Hello. This week's topics, we're going to discuss, of course, transference, countertransference, and prejudice and biases. Myself, a personal experience that I had with transference would be when I had a patient who didn't want me to be his nurse because he felt like I did not like working with him because he was gay. The reason I knew is because he was one of my patients. He was a male. He did go by he, him, but he came to me one day after I gave him his medicine, and he was like, "Well, we know you don't like us." And I said, "What do you mean?" He said, "I know you don't like gay people. You're just like my mom. That's why you look just like my mom, because you don't like us gay people." And I explained to him I had nothing against his sexual preferences. I had nothing against his relationship preferences. And I'm sorry that I look like your mom, but just because I look like her, it didn't mean that I had the same viewpoints of her, because I was professional and I had nothing to do with what he preferred to do, in his personal life. And that first day that I worked with him, he was still having like this standoffish attitude and upset towards me. But when I came back the next day, he also had a diagnosis of bipolar. When I came back the next day, he I noticed that when I handed him his medication, he touched my hand. And I looked at him and he looked right at me eye to eye, and I felt like he was trying to test to see if I had an issue with him touching me because he was gay. And I just act like I didn't even notice that he had touched my hand. I gave him the pills, and I noticed after that he was a little bit more open to me. So like I said, I think me reminding him of his mom was the where this transference originated from. That was the time that I encountered it, and then I didn't have issues with working with him, only because, like I said, I think he kind of gave me a test when he touched my hand and realized that I didn't have any issues with touching him. And the patient was also HIV positive. But I didn't show any signs of being uncomfortable when he touched me, and I treated him like I treated the other patients. When it comes to countertransference, I did have an incident one time where I had not an incident, but I did have a patient. It was a female young lady. She had been dealing with a lot of trauma, and most of her trauma had been from her being sex trafficked. She reminded me of a family member who wasn't sex trafficked but had been sexually abused when we were kids. I didn't know about it until we became adults, and she went through a lot of trauma and a lot of pain. And I always wondered why she was a little bit different and a little bit quiet. And when we got in our 20s, she told me what happened, and I understood her better. And I feel like I always was close to her, but I got even more close to her because I felt like she really needed somebody to open up to. And the fact that she trusted me with that information of her being sexually abused as a kid, it really made me feel like I meant something to her, because she didn't tell many people about it. When I started working at my job, working with the adolescents, and I met this young lady, she not only looked like my cousin, but her story was just so close to hers. My cousin wasn't sex trafficked, but a lot of what happened to her took place with this young lady. So I will say I took a liking to her, and I did a lot for her, because she didn't have any parents. She didn't have a support system. Excuse me. So I like went out and I got her some clothes. I got her some shoes so that when she discharged, she would have something, because she was going to a foster home. And she stated that the foster home also wasn't really doing much for her and taking care of her. So I felt like my relationship with her was okay. At some point, I did start to wonder if I was, being a little bit too caring, because I had to, of course, remain professional. And I did. But when I say that, I mean, I don't want the other kids to feel like I cared more about her than I did about them, because I cared about them all the same. But I did take a special liking to her because she reminded me a lot of my cousin, and I kind of felt her story more, because she would open up and talk to me more and tell me a lot of what was happening. But I do know that originated from her connection to looking like my cousin, and I felt like it was a healthy relationship. But at the same time, when she discharged, I was also happy, because I knew I no longer had to worry about, feeling so sorry for her, and I knew I wouldn't keep up with her. I wouldn't reach out to her, and even when she would call and ask to speak to me after she left, I wouldn't talk to her anymore. I just felt like that was the professional way. And I've never had a prejudice or bias moment myself, but I have had patients that way who were racist and didn't want me to give them their medication because I was African American. And in that situation, I would just let one of the Caucasian nurses that was working with me give them their medicine, because I felt like for them to get the treatment that they needed, even though them feeling prejudice towards me isn't okay. at the same time, I have to be professional. So to make sure they got the treatment that they needed and got their psych meds, I would just let a Caucasian nurse give them their medicine. And I just felt like that was the best thing for both of us, because I didn't want them to try to attack me or throw water in my face because I gave it to them. And at the same time, if that was something that was preventing them from getting the care they needed, then something simple as that. I can't control what some people grow up with and what they were taught by their parents, what society teaches them, what their community teaches them, and what that is what most of the prejudice and racistness and the biases come from in our community. So, I felt like the professional way would be to continue to care for the patient the same, but at a distance if that's what made them comfortable. And that's about it. And that's what wraps up this journal for this week. Thank you.